My first question to you is about the unvaccinated. This goes beyond science. This is about, for some, ideology. For others, it's about a matter of faith. For a lot of people, like in the piece that we just ran, it's really about a freedom of choice. What do you say to those who are unvaccinated and want to stay that way?
Well, what I do as a primary care physician is I try to provide them with the right information. One of the biggest problems with people being hesitant as far as wanting to hold off on getting vaccinated is they just need more information. There are a lot of myths out there that are not true. There's a lot of fear because a lot of people just don't know. There's a lot of unknown. So what we do is we work very hard to provide them with the accurate scientific data, the information as far as the safety, and we help them so that they can make a more educated decision.
I really appreciate the way you worded that because, one thing that was brought up in my conversations with those who are unvaccinated is the need for a conversation, the need for compassion. This is very personal. This is about our health, and in some cases, it's a life or death situation. Let's talk about the Delta variant. We've heard a lot of reports about it being very contagious, and now we're getting new data that it could be more severe than previously thought. Is it more severe than the earlier strains of coronavirus?
Well, I did a lot of research, and I'm referencing a Washington Post article that was released on yesterday. And there was a lot of information about a CDC internal document. And in this document, there was a lot of different data that was from a lot of various research. And overwhelmingly, it's being determined that this Delta variant is much more infectious, and it's appearing to be much more virulent, meaning it causes people to get much more sick and even more so probably have a higher probability of losing their life. That's why it's so important that we really, really pay attention right now and really urge people to get vaccinated. In this particular article, they also referenced the fact that it's kind of confusing to a lot of people because we're having a lot of breakthrough infections, and the new data is showing that people who have been vaccinated, they can still contract coronavirus. And the new data is showing that they're also infectious, meaning they can contract it and pass it on, even to the extent of someone who's not been vaccinated. So that's a very confusing message. But still, we have to keep the message out there that if they do get vaccinated, they still have that protection so that if they contract coronavirus, they have a much smaller chance of getting severely ill or losing their lives.
Speak to the fact that that document from the CDC, that internal document you were referencing, is comparing the Delta spread to the chickenpox. What were your thoughts surrounding that?
It is very scary. In the medical field, our job is to help people so that they can get less sick, and overall we want to save lives. And now that this Delta variant is demonstrating that it is more infectious, meaning that before, like for instance, I quoted a study out of Israel that showed a 39% effective rate as far as somebody getting vaccinated, protecting them from contracting coronavirus. With the previous strain, there was a 95% protection rate. So this variant is much more infectious, but we still want to remind everybody, if you get vaccinated, there's still a 90% success rate as far as protecting you from getting severely ill or losing your life, especially if you're someone that does not have chronic medical conditions.
We have one more time. We have time for one more question, I should say, and it's about Mississippi. I know that is the state with the lowest number of vaccinations in the country. Now we're seeing a spike in cases. Are more patients opting to get the vaccine now?
Well, we're working very hard. I actually had a conversation with the Mississippi State Department of Health officer today, Dr. Thomas Dobbs, and he conveyed to me that we have lost a child this past week. There was this teenager, he had not been vaccinated. But what we're trying to do is continue to educate and just pound that information out to the community, continue this education campaign and encouragement, and just have those conversations so people can make those more informed decisions.
Dr. Timothy Quinn, we appreciate you joining us tonight. Thank you.
Thank you.